Okay, so today we will discuss endocrinology. So, first of all, thyroid gland. Thyroid gland, its embryologic origin is thyroid diverticulum, and then this thyroid diverticulum developed from floor of primitive pharynx, and it is endodermal origin. Okay, then key anatomical notes. So, sometimes there is cyst in the interior midline neck mass that move with swallowing or tongue protrusion. So there will be a scenario of a mass in the midline of neck, and they're saying that on tongue protrusion or on swallowing it is moving. So this is thyroglossal duct cyst, okay, and it is benign usually. Then anterior pituitary gland. So anterior pituitary gland is also known as the master gland, and it is developed from the Rathke's pouch, which is oral ectodermal origin. Okay, and it synthesizes and release flat pig hormone. This is indicating FSH, then LH, then ACTH, then we are having TSH, then prolactin, then we are having growth hormone. So all these are released from the anterior pituitary glands. Then posterior pituitary gland. So its embryologic origin is developed from neuroectoderm, okay, from hypothalamus, and it store and release antidiuretic hormone and oxytocin. So oxytocin and antidiuretic hormone, it is mainly synthesized in the hypothalamus, not in the pituitary gland. Posterior pituitary gland just store it, and whenever there is signal, so it release then these hormone. Then we are having adrenal cortex, so it's having mesodermal origin. Okay, and in adrenal cortex we are having mainly three layers. There are three zones. The first one is zona glomerulosa, the second one is fasciculatum, and the third one is reticularis. So zona glomerulosa, zona fasciculata, zona reticularis. So these are three layers. Okay, so we can also say GFR. Okay, now zona glomerulosa, it secrete aldosterone. Okay, aldosterone. Then fasciculata secrete corticosteroid, cortisol, and then reticularis secrete androgen. Okay, so we can synthesize this from the mnemonic. The deeper you go, the sweeter it's get. Okay, this is so this is adrenal gland. In the middle, there is adrenal medulla. Now these are the layers. So it's first layer zona glomerulosa, fasciculata, and then reticularis. Okay, so this secrete aldosterone, then cortisol, and then androgen. So the deeper you go, the sweeter it gets. Okay, then layer from superficial too deep. Okay, then we are having adrenal medulla. So one thing you must know, and this is really important, that adrenal medulla is derived from neural crest cells. Okay, so it is derived from neural crest cell, and there is just preganglionic neuron. There is no postganglionic neuron. So it serves as a postganglionic neuron. It secretes adrenaline, norepinephrine. All this is secreted by adrenal medulla. So this secrete catecholamine. Then adrenal cortex, steroids, and regulation. So we have discussed this. These are the zones: glomerulosa, fasciculata, and reticularis. So glomerulosa is regulated by angiotensin 2 and potassium. So whenever there is increase in potassium and angiotensin 2, so it secrete aldosterone. This zona glomerulosa secrete aldosterone. Okay, an enzyme which is involved responsible. So this is aldosterone synthetase. Okay, and it is mineralocorticoid in nature. Then fasciculata. So fasciculata is regulated by adrenocorticotropic hormone from the pituitary gland and corticotropin releasing hormone which is from the hypothalamus. Okay, and it is glucocorticoid, sugar controlling. Okay, then hormone produced. So the hormone produced is cortisol. The hormone produced is cortisol. Okay, so fasciculata secrete glucocorticoids. Okay, cortisol, and their enzyme involved is 17 alpha hydroxylase, 21 hydroxylase, 11 beta hydroxylase. So all these are responsible for the production of cortisol. Okay, these are developing from steroids. Okay, then reticularis. So reticularis is also controlled by ACTH and CRH, and this is sex hormone androgen. Okay, and this include uh, androstenedione dihydro androgen. Okay, so all these is included. These enzymes are then responsible. So glomerulosa, fasciculata, and reticularis. So glomerulosa, aldosterone, fasciculata, cortisol, reticularis, androgen. Okay, sex hormones. Now, major action of cortisols. Okay, so cortisol increase the appetite, it increase the blood pressure, it increase insulin resistance. Okay, so those who are having stress all the time. Okay, so there is increase of cortisol in their body. So this may lead to insulin resistance. Okay, this is diabetogenic. Then gluconeogenesis, lipolysis, proteolysis. So this is it's another uh, action on the body. It increases gluconeogenesis, glucose level in the body, protein breakdown occur. Okay, then fibroblast activity is decreased, immune inflammatory suppression occur, and bone formation is decreased. So those who are taking prolonged steroid for prolonged duration, so they are at increased risk of getting osteoporosis. Okay, so this was all about adrenal gland.